Hello and welcome to Unit 2 of this module on fundamentals of disease intervention. In this second unit, we'll be looking at partner services. A complete sexual history includes what we call the 5 Ps. In the previous unit of this module, we shared with you the CDC's documents, a guide to taking a sexual history. As is highlighted in that document, a complete sexual history includes inquiring about the 5 Ps, that is partners, practices, protection, past history of STDs, and prevention of pregnancy. Primary care providers most commonly inquire about sexual activity and history of STDs, but less often ask about the number of sexual partners, gender of sex partners, and specific sexual practices. Several studies have determined that STI clinics obtain more complete sexual histories than primary care clinics. So partner services is part of a comprehensive strategy of quality STD clinical services. The CDC organized the recommendations for quality STD clinical services into 8 sections. These include sexual history and physical examination, prevention, screening, partner services, evaluation of STD-related conditions, laboratory tests, treatment, and referral to a specialist for complex STD or STD-related conditions. So again, here we see the emphasis on partner services. So the essence of partner services is the prevention of reinfection and interruption of transmission of sexually transmitted diseases. So treatment of sex partners prevents reinfection and is essential to interrupting the transmission of sexually transmitted diseases. What are the strategies for partner services? Partner services consist of various strategies with differing levels of time and effort to enable persons who are exposed to an STI to be identified, tested, and treated. So these strategies include guidance regarding notification and care of sex partners, interactive counseling for partner notification, expedited partner therapy, and health department's disease intervention specialist elicitation of sex partner information to identify those who might be infected and to identify patient follow-up needs. Guidance regarding notification and care of sex partners is described as providers giving how-to information to their patients about the need to notify their sex partner or partners of the exposure, the need for sex partners to seek care and treatment even if they do not have symptoms, and where a partner could go for STD care. This strategy typically does not require extensive staff training, and guidance might be verbal or written. So when notifying partners of an STI diagnosis and need to return for treatment, providers can advise patients to bring their sex partner with them, at which time the provider should treat both partners concurrently. In interactive counseling, the provider and patients both actively participate in an individualized plan to notify the patient's sex partner or partners. Interactive counseling typically is conducted by staff with specific training or skills in communication, interviewing, or counseling. So the patient provides information about their sex partner or partners and develops a plan with the counselor to notify partners. So notification might involve the patient, the provider, or the health department, and efforts to notify partners can be documented and assessed. So expedited partner therapy typically is recommended for sex partners of patients who have received a diagnosis of chlamydia or gonorrhea or both, and who are unlikely to access timely care. So this is a method that provides medications or prescriptions to the patient to take to a partner without the partner first being examined by a healthcare provider. So EPT is legislated or regulated at the state level, and what each state follows can vary by STD, age, group, and sexual orientation. So EPT has been legal in Idaho since the year 2012. So for one of the resource activities in this unit of the module, you'll be studying the Idaho State Guide for Healthcare Providers as regards EPT in Idaho. A disease intervention specialist is a public health professional with applied expertise in client-centered interviews, partner services that include contact tracing, directly observed therapy, field specimen collection, and field investigation in outbreaks, and navigating healthcare systems to ensure patient evaluation and treatment, among other areas. So the position does not require a license, although persons with medical licenses sometimes serve as investigation specialists. So relevant program areas include sexually transmitted diseases, HIV, tuberculosis, other communicable diseases, outbreak investigation, and emergency preparedness and response. Disease investigation specialists investigate STDs mandated by jurisdictional needs, and providers in healthcare settings are encouraged to develop relationships with their local health departments so that they can involve the disease investigation specialists in the cases routinely investigated on the basis of resources available in the jurisdiction, and better inform their patients about disease investigation specialist services. Here we see the CDC's partner services recommendations for sexually transmitted diseases. Primary care setting is defined as a place where patients are evaluated for various health conditions. And sexually transmitted disease specialty care setting is defined as a place where the focus is on providing patients with timely, comprehensive, confidential, and culturally sensitive sexually transmitted disease care. And sexually transmitted disease care delivered in sexually transmitted disease specialty care settings includes all care delivered in primary care settings. So partner services can be provided on site or by referral. So we can see from the table that the following partner services should be available as basic STD care services in primary care settings: guidance regarding notification and care of sex partners, EPT where legal, and then the following partner services could be available as a basic STD care service. That's interactive counseling for partner notification.